how can we get to the root cause, right? Chiropractors always say, what's the root cause? Or functional medicine's always saying, what's the root cause? How can we educate mom and help her the second time around, or the third, or the fourth, fifth, whatever it is, so that her next experience is going to be different than that first one? How can we make sure that her first experience is amazing, right? How can we inform mom, and how can we do that?
All right, chiropractors and chiropractic students, welcome to the Family Practice Podcast. You know, the one you've been waiting way too long for, because this podcast will actually stay focused on chiropractic. Not only what it takes to get world-class clinical results for kids and families in your community, but also what it takes to build a legendary, incredible family practice that takes care of your family way beyond your dreams. I'm Dr. Tony Ebel, and I'll be joined by Dr. Matt Hill, Dr. Allie Wright, Jackie Jakubowicz, and incredible guests, Chiros, associates, CAs, all these folks making massive impact around the world. We're going to cover everything: pediatric, perinatal, family practice. This is the podcast you've been waiting for, because moms and dads and families have always needed us. Now they're finally ready for us. I hope you're ready for the Family Practice Podcast. Let's go.
Welcome back to the Family Practice Podcast. I'm one of your co-hosts, Dr. Allie Wright, and I'm here with Dr. Chandler and Dr. Rachel out of the Well in Fort Wayne, Indiana. And I'm super excited for this podcast. I think I say that every single time. I'm super excited for this podcast, but I really, truly am, because I think that this is a bridge that we are going to build today that is missing in family chiropractic. And that is that a lot of chiropractors, right? We come out of school and we want this perfect wellness practice. We want all of the home births and all of those kids that are just running around. They've never had an intervention, and it's basically heaven on earth, and life is just perfect. Mm-hmm. That's what we picture as the really crunchy chiropractors. There's a whole nother side of things in the land of perfect storm that we see, where it is 40% of kids now, and I've even seen some stats that say 52% of kids have a chronic illness today and are really struggling with the perfect storm. So all of that cascade of events and interventions, from prenatal stress or fertility stress to pregnancy stress, and interventions, birth trauma, colic, ear infections, ADHD, depression, anxiety, and now they're a worn out and wound up adult, right? And so that really is the perfect storm in one tiny sentence, in a nutshell. And so we're seeing practices who also just focus on that, which is absolutely amazing. But I want to marry the two today. And so how can you have both? And that is why Dr. Chandler and Dr. Rachel are here, because they do. They really do have both, where their social media and their PX Plus marketing and all things are really a lot of perfect storm based, with pregnancy involved and with those things. And then they also own the huge prenatal practice to it as well. And so you can do both. And that's what we're here to talk about today. So I want to start with you guys telling us a little bit of your patient dynamics and your, who is your target market, or what is your office truly built out of?
So our patient dynamic is made up primarily of moms, kids, families, right? So it's basically 85% is going to be a mom, a kid, a perfect storm, or someone that's pregnant. And the rest is more of our wellness patients that are not necessarily coming in as part of a family. They might have kids, or they might be a mom or a dad, but they're just there for more wellness.
Yeah, maybe they found you off of a Google ad, or they found you off of that you're, the best chiropractor in the area, or whatever it may be. Those are like your 15%.
Yes.
Yeah.
Wellness.
And then the family practice side of it, over half is going to be our kids. And then the rest is pregnant moms perinatally. And then the rest is moms that have had kiddos and that they are just continuing to bring their children in. And so when it comes to that, we really pride ourselves on being so family forward and focused. And so you can do it. You can have both.
Yeah. That's awesome. I like to hear that you guys aren't, a lot of the times we say, we're a pediatric office. Of course you have those 15% that are coming in for back pain or whatever it may be, but then you're educating them back into the nervous system focus, because I remember asking you guys of all right, 85% nervous system focus, and then the 15%, you're like, no. All of these patients are on a care plan. They are nervous system focused. So talk to me about about that 50% of the 85% that are that perinatal phase of life, right? You have the fertility, you have the pregnant patients. And how did you guys really want to specialize in that area?
Yeah. So basically, I mean, I've always been fascinated by birth, even since being in school. And I think I guess I always knew once I had learned about the perfect storm through the pediatric experience, I was like, okay, so now we know the perfect storm. We know how to help them. How can we prevent the perfect storm? And with preventing the perfect storm, that's where you need to take the perinatal experience course, right? So you need to know how can we get to the root cause, right? Chiropractors always say, what's the root cause? Or functional medicine's always saying, what's the root cause? How can we educate mom or even back to, right? Preconception, and how can we educate mom and help her the second time around or the third or the fourth, fifth, whatever it is? How can we help mom so that her next experience is going to be different than that first one, right? Or even sometimes a first-time mom, how can we make sure that her first experience is amazing, right? How can we inform mom, and how can we do that? And so that's what really got me excited about starting a perinatal practice and seeing pregnant women, and myself just having a really positive first experience. Because a lot of people are scared, first time around, they're like, I'm just going to do whatever my doctor says and I just trust and whatever. But you actually really have to be educated. Yeah. And also as a chiropractor, be able to inform your patients on, hey, what does this test mean? Do I need to do this? And just helping that way, helping educate is so, so huge. And then I will say too, we see moms, maybe their first trimester, right? They just found out they're pregnant and they're coming to us, which is amazing. Or we see them even before they're pregnant and we're the first people to find out that they are pregnant, which is the coolest thing ever. And so finding out that they're pregnant, and then we need to create a care plan. So as soon as a mom comes in at 8 weeks pregnant, we are going to care plan for her nervous system. Okay. Our care plans are going to be specific to what her scans look like, what are her goals, all those things. And so that's really, I feel like what's different is that we're not just telling her, hey, come in once a month, come in once a week, through pregnancy, no big deal. It's a huge deal because your baby's nervous system is, like you said, hitchhiking off of mom's. So if mom's on the gas pedal, we do not want that baby to come out on the gas pedal, right? So we need to get mom to be calm, centered, regulated.
Go off, Dr. Rachel.
So that she can be, so that she can have that best birth experience. So that's why we want to start with the care plans like that.
Yeah, I love that you said that. Also, credit to Dr. Lindsay Cantu. She's the one who always says baby is a hitchhiker on mom's nervous system. But it's so incredibly important to realize that pregnancy and perinatal focused care needs a care plan, right? We're not just talking about, oh, my OB referred me here because I have a breech baby at 37 weeks. Yeah. Can you please turn my baby? Yeah. Chiropractors know we 1000% do not turn babies. Yeah. What we're doing is focusing on the nervous system. And so yes, being Webster certified is so incredibly important. Yeah. We want to help mom have that ultimate, optimal birth of having a baby that's head down. That being said, we can't guarantee that, right? We don't know that the baby's going to turn. The best position for baby might be breech, which is a normal variation of birth. Exactly. Period. But then after that, it's why are we seeing these moms? Why do they actually need nervous system focused care? And that's the nervous system, because hitchhiker on, mom's nervous system or whatever mom's nervous system is, baby is going to mirror that as well in development. And we want that optimal birth for them. Yes, we want them to have that best experience that they can. Yeah. But that being said, we can't control everything. No. There are times where we truly need that C-section. There are times where we do need the intervention. But what we can guarantee is that mom's nervous system is adaptable and regulated and resilient. And so will babies if they're matching and mirroring mom's nervous system, co-regulation, all those fun things that we talk about in the perinatal experience that chiropractors do need to be involved and invested in, that education. But it really is marrying the two, because what do we see, right? That 40 to 52% of kids are also going to be coming into your office. So I want you guys to also talk and segue. It feels like you have two different practices, and that's what we talk about at PWC too. We have our wellness and pregnancy practice, and then we have our perfect storm practice. So talk to me about your guys' perfect storm side of things and how that brings in the pregnant moms as well.
Yeah, definitely. So of course, moms see this need with their perfect storm kiddo, and they might not even know that their kiddo is a perfect storm, and they just might think, okay, there's all these things going on, and I heard that chiropractic care might be able to help. I've already tried PT, OT, language pathology, all these things under the sun, and then they listen to one of Dr. Tony's podcasts or something, and it's like, okay, get on the directory, see what's going on, and then they come to your office, and a lot of times if they've tried all of those things, they're coming to you with like just a glimmer of hope. Yeah. And that's really all they need. And so then you really pour into that mom, and that's why creating an office that is so nurturing, open, and welcoming to them so that they feel comfortable to bring their sensory kiddo who might cause a scene, that it's okay. And so we really, really try to just dive deep on those initial visits or phone consults or whatever it might be, and just continuing to educate mom on how we can help their kiddo. And then when we start asking questions about what was your birth like with, Alex or whoever it is, what was your life like pregnancy and pre-pregnancy? And then that really gets mom thinking, oh my gosh, I didn't think about how I had a death in the family, or we moved, or, our relationship with my husband was a little rocky, or whatever it was, how those things, like you were saying, impacted my nervous system. Then fast forward a couple months later, now that same mom is pregnant. She knows that conversation that you just had with them prior for their perfect storm kid. And she's like, no brainer. Like, when's my scan, Dr. Chandler?
Exactly.
And so that is how we've really created that. Is also a side thought is when we're working with Alex and helping him with all these different things, perfect storm wise, and then mom is seeing the adjustments and being a part of it and making the time commitment, then, we're talking to them each adjustment about how all sorts of phases of life, nervous system regulation is going to help with that. And then if she knows that her best friend is pregnant too, she'll be like, hey, like, you've been such an awesome resource for me and my family. Thank you for helping me with Alex. You should be under care yourself so that you can have the best pregnancy possible. And so like you guys have been saying that, it's not having one without the other. If you're most passionate about helping perfect storm kids, I would really recommend on getting Webster certified, getting all involved with the perinatal experience so that you can then prevent the perfect storm, right? Mm-hmm. Of course, you're going to do a lot of awesome things for perfect storm kiddos, but you can also prevent it.
Yeah. And you can help their family for generations to come. You're breaking those generational curses that we always talk about of like, it sounds cliche and things, but it's true of like, once this family is under nervous system chiropractic care and their nervous systems are regulated and adaptable, and then they're growing more babies, and then that birth is, their redemption birth or whatever it may be. And then that baby is now growing up having kids, and that baby, that nervous system is going to keep getting more adaptable and regulated as it's under care and all of those things. And that's just so important. So I want you guys to talk about, because this is one of the biggest questions that we get is, okay, how do we actually care plan for a pregnancy? Is it going to be 9 to 10 months long? Or, so let's start with phase one. Say that someone comes into your office and they just told you that they're pregnant and this is their first restoration care plan. What does that look like?
Sure. Well, first thing, they're going to get scanned. Every single patient, whether it's back pain, Bob, or anybody, is going to get a nervous system scan. So scans dictate plans, right? It's the window into your nervous system. So whatever their goals are and whatever their nervous system is telling us through those scans, we feel that care planning is the bridge to get them to where they want to be. And so, of course, we're going to be sensitive and pay the most attention, maybe not the most, but a lot of attention to what they really want out of the care. But then we also their goals. Exactly. We're also going to place just as much emphasis on, hey, we need your nervous system to change and be regulated to get this birth that you want. And then you see this light click on and turn on for the moms that it's like, okay, so even though I go see my OB or my pelvic floor, PT once a week or, maybe every other week or something like that, I'm going to need to get adjusted a lot more than that, because this marathon coming up in 9 months is going to be, pretty intense. So to just get really specific with it, depending on the scans and the situation, that mom most likely is going to be getting adjusted 2 to 3 times a week. And then that might go on for 3 or 4 months or so. So if it is someone in the first, trimester or even earlier, that's not going to get us to that, the big event.
Right. The birth prep.
Exactly. So what we tell them is, okay, then you finished the care plan. You did awesome with that restoration phase. Now we're going to continuing to just keep you comfortable, keeping the nervous system regulated. But then at the back end of this thing, we're going to ramp it back up again to make sure that you are totally regulated to get this birth that you want. And so then we just call it a supportive wellness, to where maybe instead of getting adjusted once a week, now you're back to twice like you were before. But financially, there's, we include that as far as continuing to see them, but they're getting more adjustments. So it is a little bit of a price increase, but it still helps make sense for them.
I think what you're trying to say too is that they go down to wellness pricing.
Yes.
So once the restoration, their care plan, whatever it was, 3, 4 months, 5 months, depending, right? Then after that phase, then they go down to our wellness plan. And with wellness, we're still scanning every 12 visits and everything. And then we always preface when we tell them they're going down to wellness, which for us is typically once a week, depending on the mom. Yeah. We'll tell them, yes, we need to ramp that up to supportive, maybe even supportive plus, depending on the mom, to do that birth prep. So we always just tell them that once they're finished their care plan, so that they are prepared and know the importance. So then when that, time comes, 10 or so weeks later, then they're not surprised. And they want it, right? They know how good when they're getting adjusted multiple times a week, and how much it was helping them stay regulated. So they know how important that is.
Yeah. And they trust you, right? Because they've already gone through that restoration care plan and they know that chiropractic works, and they want to go into birth with as many visits as they possibly can, especially how you feel, right? When you're 40, 41 weeks pregnant, I'm getting adjusted every day. So I'm going to boost those plans or those adjustments. And even, Dr. Dawn from Perfect by Design always says, if you were once a week and I adjusted you on Monday and you give birth on the following Sunday, I haven't adjusted you in 6 days. So we really do want to ramp it up, when it's closer to birth. Definitely. And so that's a really good point that you guys said. And I think a lot of the times as chiropractors, we think, pregnancy, once a week, once a month, once, bi-weekly, whatever it may be, but you have to be care planning for the nervous system. So that's incredibly important. Say that a mom does start in the, late second trimester, early third trimester, late third trimester. What are you doing with her care plan?
Yeah, definitely. So we really do see all ends of the spectrum. We see those moms who come in at, 8 weeks and their goal is a regulated nervous system and a natural birth. But then we also see those moms who maybe their OB, has heard of us and was like, hey, you can help turn this baby, or you have sciatic pain, go to this chiropractor, right? And so we see all ends. And so with a mom who's let's say 32 weeks pregnant. Okay. So she's, in that early third trimester, we are going to, again, care plan for her nervous system, right? We do it for everyone. It doesn't matter how pregnant you are. It doesn't matter, it doesn't matter where you're at and who you are. You are going to get a care plan for your nervous system. So with that, what we do is likely their care plan is going to go into the postpartum period, which is amazing because moms need that care postpartum. If you have had a baby, or if you're a dad, that mom needs that care most immediately postpartum, right? Because your nervous system has gone through so much. And something else we do is, even if mom is maybe not at that, so now mom's postpartum, she comes in, of course she brings baby in with her, and we're educating that whole time, doing table talk, explaining about how important that is. But when she comes in early postpartum, we are scanning her that first visit, even if she's not at that 12th visit yet. So we would do a more complimentary scan we need to get her checked because her nervous system is going to be totally different than when she last got adjusted.
Yeah.
Even if it was 2 days before, right? Because she has just gone through a major event. And then we will have, make sure we set up baby as a new patient. So baby will also get a scan. Even if they're 2 days old, we will scan baby and we will get a care plan for baby so that we can set baby up for success and again, prevent the storm.
Yeah. And it's really important to care plan, whether they are the ones who were the early care plan phase of that first trimester or the later one, to care plan through postpartum. So the early one, you're going to tag on a few boosts. You're going to say, all right, you got to be in here. For the late one, you're care planning through postpartum because of what you said. And because no mom who just gave birth wants to go through a financial conversation,
Yeah.
right? So if you're doing that transition in care right after postpartum, right? Or postpartum, no, thank you. Like, I'm probably not going to show back up. Right. So I want to know I can just walk in and get adjusted, or I can walk in, get adjusted, schedule my scan for the next time. Mm-hmm. And so that's what's really important too.
Yeah. With that, it made me just think, being real on this podcast, I think is important. So if it is a mom later in pregnancy and you're giving her like a 3-month care plan, she's probably thinking about it. And I just had this happen last week where a mom signed up for care and she's like, well, I don't know how I want to take care of this because I'm probably not going to want to leave my house for like 10 days, like the 5-5-5, right? Mm-hmm. And so I told her, of course. And that's my wife. She didn't want to leave the house for 2 weeks either. So we're real. Like, you have to be able to have that flexibility with your CAs, with your staff, with your systems to be able to like stretch the care plan a little bit. And that's okay. Like if your true purpose and value is to give these moms the best regulated nervous system, the most comfortable experience, everything. You don't know what that birth's going to look like. Hopefully you get to create a cool relationship to where, they text you the day of their birth or like they're going into labor or we just had, this beautiful baby at home. We're excited to bring them in, whatever. But I feel like really important to get on their level, put yourself in their shoes, whether you are the mom or you're the husband, depending if you're a male, female doc, but to know that it's okay if they change things as far as like the timing of it goes.
Yeah, exactly. And then the completely opposite of the spectrum is we also want to be the first visit before the pediatrician, right? Because it's like they're going to their pediatrician a day after birth. And maybe not a lot of those home birth, they're like, they know the 5-5-5 rule. They're chilling, they're staying, they're eating soup and doing all the things, the yoni steam. But then on the opposite side of things, you want them to, we have so many patients from PWC who were the first stop after the hospital or the birth center. Yeah. And they're just bringing in mom gets adjusted, baby gets adjusted, then they go home. Right. Yeah. And so the completely opposite side of things of having your team have that flexibility for that as well is so important. I want to segue really quick into, I think a lot of chiropractors who are listening to this, hearing these big care plans for pregnancy, and they're thinking, how are we communicating this? Because a lot of moms during pregnancy, they're thinking of themselves, and moms are very selfless. So they're like, I think I actually only need an adjustment every 2 weeks or maybe every month because pain will be the first to go away, right? It's like, okay. And they're not looking towards their nervous system. So I'll let you guys speak on this after I say this, but you have to keep your communication baby focused. And that's when the mom mind is like, oh snap, this adjustment is for my baby. I'm coming in daily this week, or I'm coming in 4 times a week. I will sign that 4, 5, 6 month care plan because I know that it affects my baby. So do the birth and beyonds for these patients. Make sure that that's a mandatory workshop that they're coming to, because that workshop is solely focused on the nervous system of not only mom, but baby too. So when you're communicating that to them, they're like, oh snap, it's not just for my back pain or my sciatica or a breech baby. This is literally setting up the blueprint for my baby's life, not just having that awesome birth. Yes, all of these things are so important, but when you think it's setting my baby's life up for success, I'm going to do anything for that. So that's the communication we kind of go off of. Do you guys have anything else? I know you do that as well, but what's your other tips to really get this pregnant mom to sign that big care plan? Yeah. And there are also a lot of young moms. Maybe they aren't financially stable quite yet. Maybe they don't have. So how do we make this a priority and an investment in their health?
Yeah. Number one, I would say is we draw the hierarchy of healing. So if any of you guys know that, that triangle, that hierarchy of healing, we draw it at every single day too. So a prenatal mom, we're drawing that hierarchy. And when we're drawing that hierarchy and focused on the autonomic nervous system, we're explaining baby's nervous system is forming from your nervous system. And if, then going to their scan, checking if they're on the gas pedal or is their body in that state of dysautonomia, we can then relate that to mom and say, this is where you're at. We need to change this for your baby.
Yeah.
So I think that too. And of course, as a mom, you're totally right. Moms are selfless. And so just relating that and just speaking the truth, because we know what happens when mom is dysregulated, baby comes out dysregulated. So we need to prevent that as much as possible. So just speaking the truth and just explaining it. But I honestly think drawing that triangle has been huge for us, with all day twos, no matter who they are, but especially prenatally, because then they understand that that's the foundation of their baby's health. And that's how they can just prevent any future storm, really, as best as they can. Because like you had mentioned too, we don't know how birth is going to go, right? We can have a beautiful plan. But emergencies do happen. And like you said, we want to make sure mom's nervous system is adaptable, and so is baby's, so that if an unfortunate, emergency happens, that they're going to be more adaptable than the next person. So that's really what we do there.
That just gave me a couple thoughts. So when I was like a new doc, I was really maybe nervous or held back information. And I think you can relate to that too, where we know a lot of the things that should be shared with, especially like new moms, like first time moms. So if you are a new doc, don't be afraid to share the information about what could happen if you don't do X, Y, Z, because this mom needs to hear it. Sometimes it is a little bit of like tough love, I guess, if you want to think about it like that. And then what's really cool is when you do share that information and then they have an amazing birth and then they come back to you and they're like, thank you so much for telling me that. The other side of the coin, though, is when you don't share the information. And we have a really close friend who we knew a lot of these things, but we were in our first year of practice. We weren't really sure what to say or not to say. It's a friend, giving a friend a big care plan. That's a really good point too, honestly, is like when you have like your girlfriends coming into the office and, they're pregnant and whatever it might be. And they're like, oh, I don't like, we'll come in when we want to, or like when I'll have sciatica, I'm sure, and things of that nature. It's like, no, you tell them, hey, you're going to come in and I love you and I know the birth that you want to have. And if you don't, then that's when some of these other things happen. And then you have to, unfortunately, kind of live with that a little bit, is like, man, maybe I should have just opened my mouth a little bit more and told them what they really need to know, even though it's a hard conversation.
We just had a meeting Monday like this at PwC and talking through just being bold in that sense of like, it's not scare care, but it's like, you have to tell them. What happens when you don't tell them? We just had a 2-month-old pass away at PwC, and we took care of her mom through pregnancy, and she never brought the baby in after that. So it was like, that's totally on us. Where is our communication missing? Where's our table talk? How are we, feeding in? This baby also has to be under care as well. You need to bring them right away. And so that's a perfect example of that. And that really hit all of us in the heart. We don't know what happened. Nobody knows anything else. We have not seen this mom since pregnancy. She did just come to us she had a breech baby. Then she had the C-section. So really the perfect storm, in a nutshell. And unfortunately, this baby didn't make it and passed away at 2 months. And it's just definitely a thing of like, we have to live with that, and that's on us. And it's like, I would have felt so much more comfortable being that light in her life and being like, you have to bring this baby in. It's a non-negotiable. And then it's the ball's in her court and she can decide. But if I'm not bold enough to say those things, then you do think about those things the rest of your life. Right. And so, docs, be bold and make sure that you really are sharing what we do, because we have a lot of the answers in our hand right then and there, because it starts with the nervous system, and we do need to share this stuff, or else we're being really selfish just keeping it to ourselves. I always think that being scared to tell, if you flip it of like being scared to tell your patients or to tell your friend or to tell your family member or whatever it may be, is selfish. You're being selfish. And when you flip it like that, you're like, okay, instead of like, because I'm caring about myself, because I'm being a people person, people pleaser.
Yeah.
And because I'm being a people pleaser, it's like the eyes are on me and I'm focusing on myself. But when you flip it and you're being selfless, then you're going to tell them. And so that's a great point, Dr. Chandler, to bring that up.
You know what's so cool about that is how much that aligns with like your faith.
Yes.
And
that's what we said at the Monday meeting. Like, it's so comparative to the gospel on a way lower scale, right? You're missing heaven if you don't know the gospel. And this is nervous system, but it's so true of like, it's the same parallel.
Share the good news.
Share the good news. And then it's the ball's in their court. They have to decide. We can't make anyone believe that Jesus died on the cross for their sins, but we can share the gospel. We can share the good news. We can be bold in that. We can share nervous system focused chiropractic care. We can hopefully prevent this perfect storm. So it's incredibly important. There are tears rolling down Dr. Chandler's face, but it's true. Like, we have a responsibility. It's on us and we got to deliver, and it's way bigger than the money, and it's way bigger than all of those things. And I do want to transition into money for a second, because we are business focused, and it's just going to be a one-liner here of having those bigger care plans for these pregnant moms also helps your business financially, right? And so we can't just say, oh yeah, having a pregnancy office, you definitely aren't making enough money or as much money as a perfect storm office. No, they both coexist together. And that's what's so incredibly important, is that we want to marry the two. And that's what this whole episode was on, is that you can have both and you need to have both, and you're going to be better for having both. And you're going to change the trajectory of so many families' lives.
Huh. So what's your question in that?
There's no question. I ended it. Do you want to say anything else?
Didn't expect to get emotional, I guess. But yeah, I mean, your care is what just dictates everything. And it all really comes back to whoever comes into your office, no matter what they are coming in for, pediatric, perinatal, anything. What are their goals? You're going to care plan to help them get there. You're going to care plan to help improve and change their scans. And whatever the amount of visits it takes to get there, if that really makes a difference and means the most to them, then they're going to come up with a way to have that health investment, and you can make it work for them too.
Exactly. So what's the answer, guys? Do you want a wellness practice? Do you want a perfect storm practice?
Do both.
You can't have one without the other.
Yeah.
You really can't, because if you're convicted by the perfect storm, then you're going to be convicted by perinatal. Like you have to do both.
You have to do both.
Yeah.
I love how you said that. If you're convicted by the perfect storm, you're going to be convicted to want to prevent it. Mm-hmm. And you're going to want to catch these kids before it even happens.
Exactly.
Awesome, guys. This was great. I absolutely love this. I love what you're doing at the Well. I love how you're completely transforming families for generations to come in Fort Wayne. We know they need it. My grandma's got a lot of stories about a lot of things going wrong there. So we're going to need to change it in Fort Wayne and throughout the world.
Hey, Dr. Tony here, and I wanted to say thank you for listening to the Family Practice Podcast. If you enjoyed this episode, like and subscribe to the show so you don't miss a thing. Also, if you're looking for more content from us, you can absolutely subscribe to our newsletter, watch exclusive episodes on YouTube, and dive deep into the articles and blogs on our website. All of this is linked in today's show notes. Thanks again, and we'll see you on the next episode.